Hi, are you Frankie?
Yes, sir.
Hi, I'm Chris. I'm going to be your pharmacist today, and I'm going to counsel you on your medication here. And this is the Advair Discus. What did your doctor tell you this was going to do for you?
Okay, actually, I have asthma, and I've been using the old kind of inhaler, and it seems not to be working. So,
Okay. Yeah, well, this is going to do. This is a more of a maintenance type medication, and it's going to help relieve the symptoms of asthma and prevent any kind of attacks. But again, you want to continue carrying around your albuterol inhaler, which is more for emergency use. And what the medication is the brand name is Advair. The generic is salmeterol and fluticasone. It's a combination of what's known as a long-acting beta agonist and a corticosteroid. And what the beta agonist does is it opens up your airways, and what the corticosteroid does is prevents any kind of inflammation. And the way it's used is this is the inhaler that has the doses contained within it. And if you look right here, there's a little window with a number on it that just helps you keep track of how many doses you have left. And the way to use it is you put your thumb in this little indentation right here and slide it open until you hear a click. And then this little lever right here, push that up until you hear a click again. And that's going to mean that the medication is loaded and ready to go. But before you actually inhale it, you want to exhale, empty your lungs and exhale out to the side, like. And then you go ahead and put your mouth on it, inhale the medication, hold your breath for about 10 seconds or whatever's comfortable. If you can't make it to 10, just how long as you're comfortable to do that. And then exhale slowly. And then once you're done, you want to make sure that you take a glass of water, rinse your mouth out, and just like swish and spit. Make sure not to swallow it. And then once you're done, you can just go ahead and close it up. And as for storing the medication, you want to make sure you always hold it parallel to the ground like this, because if you move it around too much, you could disturb the medications in there and just mess it up. And then also you want to make sure you keep it in a cool, dry place. If you take it out with you, don't leave it in your car. Just make sure you take it everywhere you go. And also it's good not to don't keep it in your bathroom. A lot of people like to keep medication in their bathroom, but it can get really hot and humid in there as well. So some of the side effects you might experience with this could be kind of upper respiratory tract infections such as pharyngitis or laryngitis, just like like tightening up of your throat. Another really common reaction is this condition called thrush, which is kind of like a yeast infection in the back of your throat, and it's characterized by kind of like a white coating on the back of your throat. And just by when you rinse your mouth out with the water, that kind of helps prevent that, because the corticosteroid is kind of an immunosuppressant, so that's how it causes infection, because it suppresses your immune system like that. Now, if you happen to miss a dose, actually, first off, your dosing for this is going to be twice a day. You're going to do one in the morning and one in the evening, about 12 hours apart. And so if you do happen to miss one of your doses, say you miss your morning dose, you want to take the dose as soon as you remember, assuming it's not closer to the evening dose. So if you're really close to your evening one, you just go ahead and skip the first one. You don't want to double up; that won't be necessary.
okay.
Let's see, and then. Blanked out here.
Do you want me to try it and practice?
Yeah, just go ahead and give me a demonstration.
Okay.
Make sure you know how to do it.
So you hold it this way.
Yep, keep it flat.
Yeah, and send it back. Take it back, and then exhale out and inhale in.
Oh, you want to inhale after you exhale?
Inhale. Yeah.
Inhale the drug.
I got it.
And make sure you hold it in for 10 seconds while you
Thanks.
inhale it.
Okay.
And then go ahead and rinse out your mouth with water. And should you experience any of these adverse side effects, such as the throat infection or anything like that, you can go ahead and call also the pharmacy, or you can call your doctor's office. But if there's anything kind of extreme, like you feel your throat tightening up and you can't breathe, anything serious like that, you want to call 911 and get emergency help right away.
Sure.
I think that's better. Was there any other questions you had for me?
That'll be it.
All right. Thank you very much.
Appreciate your help.